Welcome to Shore Talk. Shore Talk is designed to keep you better informed of what's going on here on Virginia's beautiful Eastern Shore. Now, here's Shore Talk.
We are joined today on Shore Talk by our friends from Bayside Chiropractic, Rehab, and Laser Therapy on Mason Avenue in Cape Charles. Segment's brought to you by Bayside Chiropractic, joined by Dr. Ed Bull and Janet, and today we're talking about massages. Welcome, gang. How y'all doing this afternoon? Whoops, let me get your microphones on. That might help.
There you go. Good to see you, Will.
Good to see you.
It's going to be a good show today. Start by saying things are happening in Cape Charles. The town has been packed. A lot of visitors, tourists, vacationers in town. Very busy, but we got a lot of good things going on in Cape Charles and in the office. And what was the name of the award that Cape Charles won? We're third in the nation on what? Happiest
best little
seaside towns,
something like that.
Yeah, it's pretty cool. So
I can't keep track of them. There's something new every day. It seems
Oh, yeah.
like. Not
Hey.
to diminish what they got,
Right.
but
Yeah.
there's just a lot of these things being given out right now, and I can't keep track between Main Street and the Brown Dog getting a lot of reputation
Absolutely.
and all that. So.
yeah, but the town got there were 10 cities by the waters, what they call seaside cities, even though Cape Charles is Bayside. Technically
they don't know
for the
that.
Eastern Shore. Right, but there were 10 cities in the United States that they put up, and Cape Charles came in number 3. So that's pretty good for Eastern Shore, a little small town. Definitely gives Northampton County a bump, which they need. So it's good things happening in Cape Charles. Some big activities tomorrow in Cape Charles all day long, and the big fireworks tomorrow night. So anybody out there wants to come see fireworks, I think they start about 9:15 or so. And Cape Charles usually puts on pretty good fireworks display. So Janet and I will be down there checking it out tomorrow. So good things happening in Cape Charles. Couple interesting patients that we've been working on the past couple of weeks. I wanted to start with one of the patients has and I mentioned her a few months back. She's been in just a couple of times since, but she was having some vision problems, losing her vision. Mom of 4 kids. The kids are all pretty close to the same age. So she's very busy taking care of 4 kids, and I think that's part of the issue is all the stress. But she's got some head forward posture issues, and they had done MRIs and CAT scans and X-rays, and of course couldn't find anything. And she had an appointment with a specialist. I think at maybe VCU, somewhere over there. And of course the specialist couldn't find anything. So I knew all along what the issue was, and now that she's got a little help for the summer with her 4 kids, we're actually able to get in there and tackle some of the structural cause. But actually, in her case, the head forward posture is affecting tension on the brainstem, number 1, and the tension on the brainstem affects the optic nerve and the oculomotor nerves, and that therefore was affecting her eyesight. So, and all this ties back to the study that I mentioned in the past, the role of the craniocervical junction in craniospinal hydrodynamics and neurodegenerative conditions. So it all gets all these neurodegenerative conditions, and that's what's happening with her eyesight. Tension on the brainstem. Also, the head forward posture affects blood flow to the brain. When the heart contracts in systole, you have a initial surge or pressure spike that sends blood to the brain. The brain has to be able to immediately deal with that pressure spike and send the blood where it needs to go and get the blood out of the skull as quickly as possible. And it does that through the venous drainage at the base of the skull in an area called occiput. It also does it with cerebrospinal fluid flow. You know, your brain and your spinal cord is encased in a nutrient-filled solution called cerebrospinal fluid. So your brain and your nervous system has to be able to pump that cerebrospinal fluid up and down the spinal cord to help with those pressure gradients, and the vascular system helps also. So the combination of the head forward posture was affecting cerebrospinal fluid flow, and she is having a degenerative type condition, and classed in that is migraines, is ALS, is MS, different types of strokes, Alzheimer's, Parkinson's. So at her young age, how old do you think she is, Janet? Early 30s?
Early 30s, I
Yeah.
would say.
So late 20s, early 30s, she's already having symptoms of a neurodegenerative condition. A lot of these neurodegenerative conditions, for example, Alzheimer's or dementia or Parkinson's, most of those show up in their patients get in their early 70s. So she was enough tension on her nervous system that she is actually developing some of these symptoms in her 30s. So we're well on our way to correcting her posture, getting rid of some of the tension on the spinal cord and affecting that cerebrospinal fluid flow. But it's surprising to me how little from a neurological standpoint, neurology standpoint, and structural biomechanics, how much your specialists and neurologists really are missing of the whole picture. You know, they run scans and they spend a lot of insurance money, but they're really, they do scans of the brain and scans of the neck, but they really not able to put the whole puzzle together, see the whole picture. And that's one thing chiropractic is so different. We look at the body, we're trained to look at the body as a whole. Say, for example, I have a patient come in with a knee problem. I'm looking at the knee, of course, and I'm concerned with the knee, but I also look at the pelvis. All the muscles that support the knee originate in the pelvis. So we look at the body as a whole instead of just individual parts. So I can take a patient that hasn't had any relief or any results anywhere else and look at other systems in the body that are affecting or causing those symptoms. So symptoms don't always show up where the structural cause is. So very interesting case there. Another patient that we've been working on for probably the last month that has had plantar fasciitis and pain in his foot for years and been walking with a limp, and it's really getting to the point where it's becoming debilitating. So working on him a couple times a week. There's an adjustment procedure for plantar fasciitis, which is pain in the bottom of the heel. Do that manual release. We've been doing some laser. A lot of his was caused by his low back and the amount of tension set up in his calf muscle. So the calf muscle, of course, inserts at the bottom of the heel. So it was really affecting, and they had done injections in his heel and he'd done medications and no real relief there. But the actual cause was in his low back. His calf muscle, gastrocnemius is what it's called, was really trying to compensate for that structural imbalance and set up all this pain, inflammation cycle in his heel. So he told me this morning, he came in for his treatment this week, and he said, I went 3 days, and he said, I didn't notice it until Sunday morning, but I went up and down the steps, and I went back up the steps and told my wife I've went up and down the steps with absolutely no pain. Wow. So he went 3 days. So we're finally cresting the hill, and we're on the downhill slope on that patient. So very interesting. We've also got a patient coming from a friend of ours coming from South Carolina. His dad actually came up from South Carolina and did some treatment with us. Was it about 2 years ago, Janet? Maybe?
Yeah.
Yeah,
within the last 2 years.
Yeah, had some lumbar degeneration, had tried some, of course, injections and medications, and had a couple disc issues, had tried some chiropractic down there, but I don't remember if the doc didn't have a decompression table or if he didn't know how to use it. So Danny came up and spent probably a week and a half or 2 weeks with us, and we got his low back issue under control, and he's been doing great ever since. Every time we go back to South Carolina, we work on him pretty much, keep him tuned up. And his son is having some cervical radiculopathy issues, pain in his neck, radiating down his arm, headaches, severe debilitating type of issues. So his son's going to be coming up and he's going to spend about a week with us, and we're going to do spinal decompression and some laser on him, and we'll get him straightened out and send him back down to South Carolina, feeling a whole lot better. So some kind of cool things going on in Cape Charles and in our office, but that leads us to, I'm going to tie massage really into posture correction. There's a lot of things that, if I have a patient come in that, for example, with Lance, lost his what they call lateral sagittal cervical curve. If you're looking at the neck from a side view, what I want to see on an x-ray is a 60-degree curve. Well, if they've lost that curve, there's some things that I do from a chiropractic biophysics, posture correction adjustments. There's some things that Janet does from a stretching aspect, from a rehab exercise aspect, but there's also some things that need to be done from a massage therapy, neuromuscular massage aspect. So that's something that we do a little bit of in our office, but if I refer a patient out for massage, and we do that on occasion, I will have a specific list or specific order in which I want the patient unwound, so to speak. I want the muscles addressed or massaged in a specific order, and I'll explain why that order is important today. So that's really the emphasis of our talk today. So we'll start with just the general definition of massage is act or art, and it really is an art, of treating the body with the hands by rubbing, kneading, or tapping to stimulate circulation and relieve tension. So a lot of the cases with these patients that have head forward posture, anterior weight bearing posture, they've lost the lateral sagittal cervical curve in the neck. That causes the head to project forward, and from a physics standpoint, every 1 inch of forward head posture adds 10 pounds. Average brain and skull is 10 to 12 pounds when it's centered over the body. If the head is 3 inches forward, that makes your nervous system think it's holding up a 30 to 40 pound brain and skull. So it causes the muscles on the trap muscles, the cervical erector muscles on the back of the patient to really over tighten. You see a person that has developed a hump at the base of the neck, that is from that head forward posture. Those muscles enlarge and overdevelop because of the head forward posture, and the muscles on the anterior of the body have become shortened over the years, so those are stretched tight and shortened. The muscles on the posterior of the body are stretched tight, so you have the muscles on the front and the back of the neck and the chest are unhealthy. They're lacking a good blood supply, and they become hypersensitive, and they become overly tight, and that is one of the key factors in fibromyalgia. All your fibromyalgia patients, all of them have head forward posture, all have tension on the spinal cord. That's what causes that fibromyalgia. So, Will, here's a question for you. How many muscles are there in the body? Just throw out a number. How many you think? Man. What would you say?
100?
More than 640 muscles. That's incredible. Yeah, more than 640 muscles. Incredible. Muscles, your muscular system comprises 40% of your body weight. So that's pretty amazing how the muscles contract. The posture or tone muscles are a key in what I deal with on a daily basis, addressing patients' posture. Your tone muscles are basically innervated or controlled by your autonomic or that automatic nervous system. Your posture muscles, your tone muscles are not muscles that you should have to consciously tell to tighten up to make you stand erect, make you stand straight. So your posture or your tone muscles, what they call the erector spinae muscles, are really controlled by what they call the dorsal horn of the spinal cord. So your nervous system has a specific selection of muscles and a specific innervation to those muscles just to give you good posture. And when you have posture issues, it's a loss of curve, mechanical curve sometimes. Sometimes that loss of curve is set up by what they call brain lesions that affect the firing of those posture control muscles. So that's what we work with essentially on a daily basis. But when I have a patient that needs some posture work, they need work on those posterior muscles. They need work on those anterior muscles. So just a few more interesting tidbits here. The smallest muscle in the body, Will, is called the tensor tympani muscle. Now, where would you think that one would? Where would that one be? Tensor tympani.
I'm going to guess somewhere in your pelvis, lower back.
No, actually, it's in the inner ear. So the tympanic membrane in the inner ear, there's a very, very small muscle called the tensor tympani, and that's what actually transmits the noise vibrations when they come into your inner ear and on the tympanic membrane, the eardrum. That little muscle transfers those noise sounds to the nervous system. So it's pretty cool. Smallest muscle in the body. What would you think the strongest muscle in the body would be? Pound for pound, size-wise, what would you think?
I was always taught in Sunday school the tongue is the strongest muscle in the body.
Well, tongue is pretty strong, but actually pound for pound, the strongest muscle in the body are the masseters. Those are your jaw muscles for chewing. So that's pretty cool. And that's why if you watch any of the animal shows, they'll test the bite force of a dog or the bite force of a lion or the bite force of a shark, other mammals.
Makes sense.
Yeah, so comparison size-wise of the muscle, and same thing for humans. Mine are strong because I like to eat.
Friends of mine right now are roasting me via my cell phone for how many of these questions I've gotten wrong in a row. So, with friends like these.
Yeah. That's right. Well, listeners, if I cover a topic once and I can come back and cover the same topic a year and a half later and will remember most of the questions I asked. So if he hears it once, it usually sticks with him. So
it's getting more and more difficult all the time.
That's right. You need some massages then.
That's right.
So you got too much stress on your muscles. So some interesting tidbits. The amount of muscles it takes to smile is 17. That's pretty cool. The amount of muscles it takes to frown is 43. So it's
I've heard that before.
much easier to smile, uses much less body energy, and hormone release, serotonin release in the brain increases when you smile, when you're in a good mood. It decreases when you're in a bad mood. So it's better from a muscular standpoint, from a brain chemistry standpoint, to smile instead of frown. That's pretty cool. Your heart muscle, autonomic nervous system innervated. It has its own inherent rhythm. Now, this is one that will nail because we've talked about this before. Your heart muscle, Will, how many beats per minute would it beat if you took it out of your body, if it wasn't slowed down by your autonomic nervous system?
200 was the number?
200. See, yeah. Will is on the money.
Take that, Hunt.
Yeah. That's right. Well, like I say, he hears it once, he's got it. Your digestive system, all autonomic, smooth muscle, innervated. Your eyes automatically focus. That is all done.
Mine don't. Mine don't focus.
Through the autonomic nervous system automatically. And Janet has a point. Normally when you get in your 40s, the lens of your eye loses some of its elasticity. So that's why you have to have, just like the reading glasses I've got on right now, the eye lens loses elasticity. Those muscles are not able to converge those light beams from your lens to your retina, so the glasses actually converge the light before it hits your eye and lengthens that distance. So pretty neat stuff. Humans are born with the total amount of muscle tissue cells that they're ever going to have. So when you have a baby that's just born, they have all the muscle tissue that they're ever going to have. It's just those muscles get larger as you age, as you grow. That's why people work out. The benefits of working out is not only do you have stronger muscles, but you have larger muscles, besides the increase in range of motion benefits. So there are different types of massage. You have soft tissue massage, you have Swedish massage, you have relaxation type massages, and those are good to get on occasion. But the type of massages that patients will get when they come in our office, or if I refer for massage, is a deep tissue neuromuscular type massage, a fix-it type massage. And if you've ever gotten a neuromuscular massage, it's not the type of massage that you fall asleep while you're getting it, because sometimes it's a little uncomfortable, sometimes it's painful, because they're actually absolutely Will's doing the elbow thing on his knee.
The elbow drop.
Yes, absolutely. And that is a fix-it type of massage. You have in your back, in your spine, you have 5 layers of muscle. So you getting massages is a process. You can't, a lot of these conditions you can't fix in 1 or 2 massages. It may take 5 or 6 or 10, because you have to get down and through those 5 layers of muscles and actually get in there deep and get some blood flowing to those deep layers of muscles. So what I recommend for my patients that have posture issues, particularly head forward posture, I will recommend that the massage therapist start the patient on their back instead of on their stomach. Now, Will, why would I recommend that massage therapist start the patient laying on their back first, what they call supine, if we're addressing head forward posture?
Well, it'll obviously make your head lean further back.
Absolutely.
If you're laying on your back than on your stomach.
Absolutely. So think about what's going on neurologically in the body. If you have head forward posture and your nervous system, your muscular system is trying to stop you from tumbling forward, from falling forward, because you're not standing erect anymore, those posterior muscles, those muscles on your back are already under a strain. They're losing the tug of war already. So if you relax those muscles first, then the muscles on the anterior shorten even more. They pull even harder because their antagonist has just relaxed. So that makes the condition worse. And I see this in patients all the time. If the massage therapist doesn't know how to address the posture issues and the neurology aspects and the chiropractic biophysics, they'll lay the patient on their stomach and work on the back muscles, because the patient says, well, I've been hurting in my back. So it makes it worse. So I always have the massage therapist start the patient supine, laying on their back, relax scalene and sternocleidomastoid muscles, those 2 muscles on the anterior of the neck, work the jaw a little bit, work the pec muscles, work the psoas, the primary hip flexor, strongest muscle in the body. So open up the anterior first, get those muscles elongated, get those lengthened. So you start the patient laying on their back, then you have the patient lay on their stomach, and you finish with those back muscles. That type of massage will enable and make my job easier as far as posture correction, restoring that chiropractic biophysics. Technique was designed by a guy named Don Harrison. He had a doctorate in mathematics. He had a doctorate in physics. He was teaching at University of Alabama. He got bored with teaching math, so he had some physical problems, just like myself. Sought chiropractic. The chiropractor fixed him, so he said, I'm going to chiropractic school. So he went to chiropractic school. He graduated chiropractic school. He and a medical doctor named Rene Callier, medical researchers, started studying the muscle and ligament attachments on the spine, and they figured out, well, based on these muscle and ligament origins and insertions, based on physics, based on mathematics, this is a normal model of what a cervical curve should look like, 60 degrees. So he developed a posture correction technique based on his research. And he started, he used his patients as guinea pigs, so to speak, and developed a technique to correct posture. So in 2 months, I can take a patient with horrible head forward posture, restore that lateral sagittal cervical curve, lengthen the muscles on the anterior, relax the muscles on the posterior, correct that posture, so it helps them with their short-term symptoms. But more importantly, when they get in their 70s, their spine does not collapse from osteoporosis and that head forward posture. God designed your spine to support weight from an axial component, from a top to bottom, not leaning forward position. So when these patients get in their 70s, osteoporosis sets in and the spine collapses, the vertebrae collapse. And these people are stuck with a big hump on their back and they're in pain all the time. So in 2 months' time, you can reverse that whole posture issue. You can take the tension off the spine before those vertebrae collapse. So always have the patient, if you're a massage therapist and you're listening, start your patient laying on their back, work the anterior muscles first, finish with the posterior muscles. That's exactly why. And we will close with a couple, one more good question here. And this might be a tough one, but there are only 2 muscles in the whole body out of greater than 640 muscles. There's only 2 muscles that cross 2 joints. All the other muscles in the body only cross 1 joint. So there's 2 muscles that cross 2 joints. What can you name one of them?
Would it be a trap muscle?
No, close.
Has it be your shoulder?
How would that be close?
Yeah.
Because I know the answer to this. You're cold.
Well, he's in the area. One,
That's terrible, Janet.
one.
I thought we were friends.
Yeah.
Well, I guessed it. I second guessed
Yeah.
myself, and then I went with something else. I was like, shoot.
Well, that's Janet's referring to one of them, but one of them is one of the heads of the bicep.
Oh, that's right. Yeah.
One
I
of the
remember
heads
that
of the
one.
bicep crosses the radial ulnar joint, which is in the elbow, and it also crosses the glenoid fossa, which is in the shoulder. So that's one that crosses.
See, I said shoulder too.
Yeah, one head of
I
the
was
seat.
thinking like here where my neck is and down past my shoulder.
Yeah.
Like that.
You were in the
Yeah, that's
general
a good one.
area. I'll tell you, Will is sharp.
I got it on the body. So
Yeah, Will is sharp. Now the other one is what they call the gastrocnemius. I mentioned earlier. Your calf muscle. Your calf muscle crosses the knee joint, and it also crosses the ankle joint. So, pretty interesting little tidbits, and that's all we're going to say about massage today. Janet, if you'll give out our contact info.
Email Bayside Chiropractic of cc@gmail.com. Telephone 331-1190.
Great.
All right.
All right, gang. That's a short talk. Appreciate it.
Thank you,
Thank
Will.
you, Will. Happy 4th, everybody.
Thank you for listening to Short Talk. This interview has been recorded and is available on WESR's YouTube page. To schedule a Short Talk for your community event or organization, call us at 757-787-3200 or email Nancy at WESR.net.